Okay, we're having a scenario where several people were just hit by lightning. We have one person running around who seems to be blinded, and we've got the medical students who are attempting to figure out what's going on. Over here, see, we've got a guy bleeding from his ear.
I'm bleeding. I'm bleeding.
Okay, we're gonna take.
I can't hear you.
We'll take care of you. Don't worry. Can you tell us what happened?
No, I don't know. We just were walking, and I don't know what happened. I can hear you. Can you hear us?
No pulse, no breath.
I can't. My ear is ringing. My ear is ringing. Can you hear us at all?
Yes, a little bit.
Do you know what happened?
No, we were just walking, and I don't know what happened.
Okay.
Yeah, I can see. I can see fine.
Justin?
Are we at Camp Dudley?
Okay,
We're
you've
at Camp
got
Dudley, right?
a heart rate of 100. What's today's date?
Regular? Are they okay? Yep, they're doing. We're helping them right now. You see, Justin's up and walking actually.
His pulse was 90. Is it regular?
90 to regular. And strong.
So,
How you doing, ma'am? Okay. You stimulate her with deep pain, and she just sort of groans. Okay. And moves everything a little bit.
Okay. Is there anything else that came up with you mentioned the bruises? Anything else that came up with that secondary?
I mean, she still has this lash on her head. Doesn't look very deep.
Okay, nothing bleeding right now?
Nothing bleeding right now, but we can't account for internal bleeding. But her pulse hasn't gone up since then, so.
Okay. So I think we need someone to keep an eye on the needle thoracostomy, and we need to start getting her ready to transfer. The cars are actually right over there.
Okay.
Are you concerned for a spinal injury?
We don't know the mechanism. She can't talk. She's altered, so we're gonna just immobilize her.
That sounds good. Okay.
Yeah.
Jessica, you're not doing anything right now?
Not really.
Can you start gathering stuff for a stretcher?
What do you want?
If we have tarps, if we have the jackets.
Dr. McStay, real quickly, what's happening?
We have 3 victims here, all of whom appear to have been struck by lightning. One person is awake and alert and just a little bit disoriented. One victim suffered a probable ventricular VFib arrest, and was appropriately resuscitated. And this is our 3rd victim who sustained probably some head trauma, had a tension in the thorax, which was decompressed. They're currently applying C-spinal mobilization and getting ready to put her on the backboard and transport her out of here.
Great, thank you.
Again, you notice on the back, left flank.
If you don't have it, we can do it again.
Left flank ecchymosis.
Yeah. Left flank, left chest.
I'm just going to bend this one when I get through it. Sorry.
That was good. Don't worry about it. Take your time.
So in general, she's just less responsive overall.
Less responsive than
she had been groaning a little bit before.
We need to get her on. How's her breathing?
So she's breathing in around 30 to 40 now.
Is it equal bilaterally?
Jessica? Yep.
So our tube's still...
You can't really tell right now just because
of
the position that she's in.
That makes sense.
What's up?
So the breathing is 55.
55. It went up.
Her pulse is 150 to 160.
Check her lymph nodes again.
Yeah. When we roll it back, we'll check.
Ready? Roll it back.
On your count.
1, 2, 3.
She has not been responsive since we found her.
You want to roll her?
But she did. She had then progressively faster respirations, put in a tube thoracostomy, which is deflated a left pneumo, and that's pretty much the situation right now. Concern for C-spine because of the multiple contusions to her head, neck, and flank area. She's still relatively unstable, although
again, you notice a large amount of ecchymosis in her left flank.
Okay.
She's very unstable
right now. On the left side, left flank. Yep. Yeah, we need to move her. I think this may be fever. We need to get her moving. C-spine's important. Keep it stable as possible. But
is she bleeding profusely from the contusion on the
no. We're going. Cars are right over there. Does anyone have a phone or something to call? Did anyone have reception
We
here?
have no phone reception at the driver there, so.
Okay. All right.
Wait. Anybody not ready?
Yeah, I'm not ready.
Okay.
Alright.
Pretty good.
Now I'm ready.
Whenever you're ready.
You guys need help? How are you doing?
Anybody not ready?
Which
We
car?
see someone.
Get the car ready.
Get the
yeah.
car.
I don't. I think she's
Clear the
pretty
path, get the car ready.
healthy.
Anybody not
I don't
ready?
know.
Okay.
She's
Let's
gonna be
recess
okay?
files one more time before we do that.
Are you guys okay with the number of people you have?
Yes.
We have extra
Her
people.
respiratory rate is
Stable.
65.
Yeah.
Her heart rate's
Oh, man.
180. And
There's a tube in her?
We're helping her breathe.
Oh, man.
Okay, they're evacuating her.
Down.
Oh, now they think she stopped breathing.
No, check her pulse.
Alright, no pulse. No pulse. Yeah.
No pulse. Ready?
Yeah, keep going.
Breathe.
No pulse, is there?
No pulse.
Sorry.
8, 9, 10,
Oh,
11,
the
12,
car's not
13, 14, 15, 16, 18, 19,
Yeah, I think we.
14, 15, 16,
If
17,
we can't
18,
go
19,
anywhere,
20, 21,
That
22,
was a long
23, 24,
minute.
25, 26, 27,
I don't want to.
30.
I mean,
Not ready to pronounce.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16,
I think we should keep CPR going for at least half an hour.
We're not going anywhere?
We apparently we can't drive the cars or anything.
We can't drive the cars?
Yeah.
Can we send someone to the road to flag someone down?
Oh, I mean, yeah. I mean, at this point,
We're stuck
we
here.
could, but it seems like
We're on our own.
no one's gonna get here fast enough at this point.
Yeah, do you
for
want
hard
to sit
stop.
down?
3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 22, 23, 24, 25, 26, 27, 28, 29, 30. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 19, 20, 21, 22, 23, 24, 25.
All right, guys, that's
Give her
it.
something.
Guys, that's
Do
it.
something.
That's
God's
30
sakes.
minutes.
At least give her the up if they're gonna call it. 1, 2, 3, 4, 5, 6, 7, 8, 9.
I don't think we need. I think we can save our resources at this point,
For
guys.
what? 19, 20, 20. Give me the
We have to walk out. All
I'm
right.
grabbing the up I'm doing it myself. Any change?
What happened?
I'm grabbing the up I'm doing it myself. 7, 8,
Guys,
9,
this is
10,
it.
11, 12, 13, 14, 15, 16,
Reassess.
17, 18, 19, 20. After you give her the epi, anything happen?
No.
6,
It's been
7, 8,
30
9,
minutes,
10.
guys. All right. Does everyone hear me? It's been 30 minutes. Okay. We've done everything I think we could. Alright, we're going to need to move her away from the trail a little bit, but still visible. We need to collect all the resources we have. It's a long walk out. We've got 2 people that were involved in a pretty serious accident right now. We need to make sure they get to a safe place. I feel like the teams did a good job of assessing each of their patients. We had pretty quickly, I think we identified that the one patient was pulseless and needed CPR. I think that was started quickly. That was a good response by that group, I thought. Definitely identifying priorities first. That was good. And that was important because obviously he came back. So I think that was a good thing to identify very quickly. And I think the people that helped out, Jay, also did a good job of kind of setting him apart from what else was going on, because we had 2 other patients that were very critical at that point, and I think Jay was a little bit of a distraction. Unfortunately, we had enough resources to have him, babysat a little bit while the other groups kind of took care of their patients. And then I think the team with Lauren did a very good job. I think we did a good job communicating. Nelson, I like that you were asking questions of everyone every step of the way to make sure that we were doing what we could do. I think it was good to kind of keep reassessing every couple of minutes, even before we started moving her and started the CPR and everything. I felt like you were involving the group in the decisions, but still making the decisions yourself. So that's an important thing. I think we did okay. I still think we might have missed something, but I don't know what. I can't think of what it was. The symptoms we were seeing were trauma related. It just seemed like a trauma situation. She wasn't responding like Justin did with the electrical.
So I think, if you sort of Monday morning quarterbacked what you guys did, I think everything was actually very appropriate and very reasonable. There's nothing that you missed. Okay? Jay?
I agree with that 100%. It's just for teaching point, just to be clear that this is an asystole, and during ACLS protocol, just so we're clear, epinephrine and atropine are indicated for asystolic arrest. So you could go, I mean, just so we understand that, you know, if you were in the ED, you would have given epinephrine for that.